Well, hi everyone, and welcome back to the SSI Spotlight on Mental Health Best Practices. I'm Brian Hainline, the NCAA Chief Medical Officer, and this is our planned final installment of this Spotlight series on mental health best practices before the official rollout in January 2023. But stay tuned, another one may pop up if something seems really compelling, and of course, we'll let you know. We've been reviewing these best practices with the membership because of the planned rollout of a completely updated best practices in January 2024, right around the time of the convention. Today, we have Carrie Wheelhouse, the Director of Health Promotion at the NCAA Sports Science Institute, and Jamie Houle, the Director of Sports Psychology and Wellness Services at The Ohio State University. And Jamie also serves as Chair of the Committee on Competitive Safeguards and Medical Aspects of Sports. So we've been reviewing these best practices with you, the membership, for the past couple of months, really as a way to prepare you and to really take you through what have been the prior best practices, which first came out in 2016, updated in 2020, endorsed by 25 of the leading medical, mental health, and scientific organizations in the country. We're updating the mental health best practices upon the recommendation of the Committee on Competitive Safeguards and Medical Aspects of Sports, to really cover some new and emerging areas. One is on cultural sensitivity and other considerations such as NIL, social media, sport wagering, and suicide contagion. We're also addressing data that we've received that indicate that student athletes are not always comfortable in supporting one another when they notice that there may be mental health concerns. They have some uncertainty regarding student-athlete referral patterns for both routine and emergency mental health issues. And also there are concerns that maybe student-athletes don't feel that the campus is prioritizing mental health. So that's one of the reasons we're updating the best practices and trying to familiarize everyone with what exists and what's to come. So today we're really focusing on what is to come. And so I'd like to turn to our guests, Carrie and Jamie, and if you could just give an introduction of yourselves and your role in all of this.
Hi, everyone. My name is Carrie Wheelhouse, and like Dr. Hainline mentioned, I'm the Director of Health Promotion within the NCAA Sports Science Institute. In this role, I'm the member point of contact for various health promotion topics, one of which is mental health. And I also am the primary staff liaison to the NCAA Mental Health Advisory Group.
Hi, everybody. Dr. Jamie Houle. I'm the Director of Sports Psychology and Wellness Services here at Ohio State. And like Dr. Hainline said as well, I am proud chair of the Committee for Safeguards and Medical Aspects of Sport. And I'm also just a member of the NCAA and just trying to understand and put in place the mental health best practices.
Well, thanks, Carrie and Jamie. And Jamie, let's start with you because you're in a unique vantage point. You're a licensed mental health provider. You have a prominent role at the Ohio State University, and you're chair of competitive safeguards. So from your vantage point, what's the importance of updating the mental health best practices for the membership and really supporting student athlete mental health on campus?
It's a great question. And, what I would say is the area of mental health in the NCAA and student athletes is changing every day. And we are seeing more and more patterns, especially coming out of COVID related to mental health. And it's really exposed a lot of areas we might have known about in general mental health for years, but now kind of really focusing in on how these topics are affecting student athlete mental health. And having the privilege of being part of the Diverse Student Athlete Mental Health Summit, we were able to try to understand where different folks are coming from and their experience of mental health as a student athlete, and able to integrate those and need to be taken into account when we think about how we are providing mental health on our campuses. So I think being part of the CSMAS and the chair, being able to be part of these different summits, as well as being a provider, it's been a unique opportunity for me to see how we do it and how we do it on campus.
Well, thanks for that, Jamie. And please know on behalf of the NCAA, we really appreciate your input because your insight is really critical in all this, and it goes a long way. Carrie, so one of the important parts, really exciting parts of developing these new mental health best practices is that it really has sprung from a newly formed mental health advisory group upon the recommendation of CSMAP. So maybe discuss a little bit the creation of the mental health advisory group and its makeup and what really their purpose has been.
Yeah, be happy to. So, as you mentioned, the first edition of the mental health best practices came out in 2016 and was then updated in 2020. Also in 2020 was the Diverse Student Athlete Mental Health and Wellbeing Summit that Jamie, you just mentioned. That summit was a collaboration between the Sports Science Institute and the Office of Inclusion to really look a bit more deeply into our diverse student athlete populations and what all kind of considerations for their mental health there were to discuss. Coming out of that summit was really the understanding that while our first edition of the mental health best practices have great foundational guidance and recommendation for membership, there is benefit in reviewing them with consideration, specific consideration for diverse student athlete populations, and specifically student athletes of color, international student athletes that identify as having a disability, and LGBTQ plus student athletes. And so in September of 2021, CSMAS then took those outcomes and kind of said, hey, let's have an advisory group that can be a standing group that meets and discusses not only these topics as they relate to considering updating the mental health best practices, but a group that can help inform us about recommendations related to mental health. And so they created this mental health advisory group with the charges of reviewing literature and current information about diverse student athlete populations to consider in updating the mental health best practices, as well as ongoing consideration of mental health topics as CSMAS kind of feels the need to have those discussions to help inform them in decision making. So this group is created of both external representatives and membership representatives. And there are 20 representatives who represent external organizations that are leading organizations in mental health, higher education, or diverse populations. Then we also have 11 representatives who come from the membership with a large student athlete representation, as well as representation from all three divisions. And the advisory group has met now on 3 different occasions to begin and complete what we call a consensus building process, really to help provide recommendations on those topics CSMAS has asked of it.
Well, thanks, Carrie. And just for the membership, this whole formation of the Mental Health Advisory Group is really a playbook from the newly written Constitution last year, consistent with the Concussion Safety Advisory Group and other advisory groups that will come upon the recommendation of CSMAPs. So Carrie, you mentioned the consensus building process. Maybe just give an example, maybe name one sort of foundational statement. We're going to talk about those in a minute, but how we come to form a consensus around, say, a principle or a statement. Just kind of take us through the iteration of that.
A consensus building process has kind of 4 main steps. The first is getting education about a topic. The next is having discussion about that topic. Then from that discussion comes some kind of drafted recommendation and then a rating process. So for example, if we take social media as a potential topic of discussion, the Mental Health Advisory Group representatives would be given some type of education on the current literature and landscape of what social media means as it relates to student athlete mental health, or what we know about social media as it relates to student athlete mental health currently. Then the advisory group would break down into small groups that are kind of multidisciplinary groups where there's lots of different representation, all the way from a student athlete to someone who has expertise in kind of national level policy to discuss these concepts. From those discussions, then, there are different kind of codes and themes identified, things that commonly come up in all the different discussions amongst mental health advisory group representatives, and those get drafted into a recommendation statement. That recommendation statement then goes out to the mental health advisory group representatives for rating, and they rate it on a scale that helps determine how much they agree with the statement, how much they think it's useful, and how easily it may be put into action. And when they hit a certain number, when all of our advisory group representatives kind of hit a certain number on that rating scale, we consider it then to be consensus-based, a recommendation at that point.
Yeah, and Jamie, maybe just briefly, what's the importance of that to you? So, you break out into a group and you'll have a clinical licensed mental health provider, you'll have a scientist, you'll have a student athlete, and then you'll come up with a statement, say on social media. And that becomes really important, that statement, because it went through a methodology that people accept as being valid. So how is that important to you as a clinician?
Well, what I love about the process is I love hearing everybody's background and expertise and how their expertise is applying to the same topic that we're all discussing. Because by no means do I believe that my role as like a sports psychologist is the only opinion. It broadens my perspective as a provider to all the different facets that are affecting this issue, let's say social media. So I'm not a policy expert. I haven't been around the country speaking to politicians or anything like that. My area, my niche is psychology and therapy, whatever. But hearing from the student athletes or from a policy expert or a scientist, it helps me and helps me feel more confident that the best practices going forward are well researched, educated, and informed.
Well, thanks, Jamie. I appreciate that. Carrie, maybe take us through some examples of what foundational principles are, maybe just at a broad thematic level.
So the foundational principles are kind of a new consideration for the mental health best practices in this update. And they're really intended to be information and education for people to think about all the different factors that might play a role in an individual's mental health. So some of the new foundational principles that we've discussed as a mental health advisory group and have had recommendations kind of moving forward for the update are things around diversity, equity, inclusion, and belonging. So for example, understanding that discrimination and harassment may be things that have a negative impact on mental health and are things that play a role in mental health. Another aspect that has been talked about is psychosocial trauma and whether that's something that has occurred in somebody's past experience prior to coming to college and playing collegiate athletics, or if that's something they may be experiencing currently. Those are things that can play a role in student athlete mental health. Some of the other concepts that have been talked about are things that are newer to the landscape of mental health since the first edition of the Mental Health Best Practices came out. And again, those are things like name, image, and likeness, social media, and sports wagering, and understanding that there is a vastly kind of rapidly changing landscape in those spaces. And so some of the foundational principles speak to considering how those might play a role in mental health as well.
Okay, Jamie, maybe speak to the importance of some of these foundational principles from your point of view, because these are covering some really important topics.
Yeah, and one of the things I really liked about how Carrie said it is like it's this great combination of solidifying things that we know, especially in the field of psychology, to be very impactful to people's mental health, and also the ever-changing landscape of things that are emerging every day as more important factors. So obviously, again, we have NIL and social media and sports wagering, but in the field of psychology, understanding that discrimination negatively impacts mental health is something we've known, but making it in this document, making it explicit and putting it there as something that we understand is foundational to how it can rock somebody's mental health is important, as well as trauma. And as we have started to understand trauma more and more, and from a neuropsychological standpoint and from a sociological and psychological standpoint, trauma can affect and reverberate through your whole life. So again, putting it in the document just solidifies and makes explicit what we want and know affects student athlete mental health.
Yeah, and boy, I really appreciate that last comment about trauma, Jamie. As a neurologist and taking care of patients with neurological problems, so not psychiatric, psychological. I mean, I hate to split between mental and physical because they're all one. but the evidence that's emerging that childhood trauma, adolescent trauma, can actually lead to neurological diseases. I mean, so it's really astounding. But on the one hand, on the other hand, many of us have sort of sensed that for a very long time. So we're explicitly discussing that in the mental health best practices. I think it's a huge leap forward. So Carrie, maybe talk about at a general level what's new in the mental health best practices, how it's organized or thematically.
So we already hit on the concept of foundational principles. That's kind of a new addition, is again, this baseline definition and understanding of factors that can play a role in mental health at the beginning of the document. After that portion, it then goes into the best practice recommendations. And while the main aspects of the best practice recommendations are not changing significantly, one of the big things I'd like to call out is that we are reordering the way that the best practices are noted in the document, and putting the best practice that really focuses on creating environments that promote mental health and well-being, and that are healthy environments and inclusive environments. That is being moved to the forefront as best practice number one. And that's really in an effort to say, hey, promoting mental health and well-being is really foundational to this whole process. And so having an environment that supports student athletes is really kind of the first step in this process. So it's being moved to best practice number one. Then the rest of the reordering of the best practices is intended to kind of follow the path in which a student athlete might go through the system of mental health care or mental health services and resources on a campus. So the next step then speaks to how we identify student athletes who have mental health signs and symptoms or conditions. The next process in that would be action plans, and action plans really kind of speaking to, once a student athlete is identified as having mental health signs and symptoms, how do we then refer them to the appropriate licensed providers for care? And then the fourth aspect, again, speaks to the licensure of those who are doing the formal evaluation and treatment of mental health care for student athletes. So that reorganization is kind of one new change. Again, not much changing in terms of the major components of the best practices, but a reordering of how they will flow in the document. The next big ticket thing to think about as we update the mental health best practices, that for each best practice, there are going to be kind of two categories of recommendations that come with it. And the first is what we consider core components. And those are kind of the really must-have things to meet that best practice, things that we anticipate all member schools can do. The other aspect is additional considerations or other elements that you might think about related to that best practice when the resources allow or it best fits within that school. So to give an example, when we talk about identifying student athletes with mental health signs and symptoms, one way to do that is through screening. And so the first edition of the mental health best practices spoke to recommending screening as part of a pre-participation examination. In the update, we anticipate there may be more discussion to say, hey, there's multiple times of year at which screening for mental health may be beneficial based on kind of stressors and timing go on. And so the core components around screening are that screening should occur at least once a year with a validated screening tool. And some other elements to consider might be, who is this tool kind of validated in? Is this a diverse population that it's been validated in? Is it an athlete-specific validated process that it's gone through? And so you can see a little bit of the breakdown there between the core components of screening at least once a year and additional considerations for thinking about who has this screening tool been validated in.
Yeah, I want to make a couple comments on that. One is just starting the document with creating a healthy environment. And so with the advisory group saying, look, that's sort of foundational. Let's get the healthy environment first and then start working on other things. I mean, Jamie, what does that mean to you? I mean, we can have all of the best plans, but if you're in an unhealthy environment, it's not going to do much. So just share your thoughts about that, creating an environment that fosters well-being, mental health care seeking.
Yeah, I mean, I think it goes from all the way explicit to implicit ways that the environment indicates that mental health you're able to talk about mental health, and mental health is similar to physical health. All these messages to break the stigma associated with help seeking are important because we know that words are one thing, actions are another. And so, this example of even moving it to the front is an example of an action to show how important creating the environment is. And the NCAA has taken a choice to do that. But it will affect, for me, on the ground, what it looks like is it affects help-seeking behavior. So if I believe that it's normal to seek the health of a mental health practitioner because, say, their office is in my facility, or I see signage different places, or there's a mental health game that's being played. These things all send signals to the student athlete that it's okay to reach out, and that will get people in the door. And that's what we need people in the door.
All right. And Carrie, I want to come back to a couple of issues. One is you spoke a little bit about the difference between the best practices with the core components and then additional considerations. And so going back to the Constitution and then legislation. So our legislation across all three divisions states that NCAA member schools must have in place a mental health program consistent with the mental health best practices. And our best practices it's a guideline. It's not telling you this is what you must do. This is how you evaluate depression and so on and so forth. But we also provide a checklist. So maybe reinforce for the membership what the checklist will be like in terms of boxes that say, well, these are really things that you should have in place. And they're kind of foundational and basic. But then the additional considerations, they aren't really boxes that you have to check off, but they're things to look at and maybe modify it for your school.
Yeah, thanks for that. That's a great question and an excellent lead in. So this edition or this update to the best practices will have a checklist just as the first edition did. And you're absolutely right, Dr. Hainline, in that there's oftentimes questions from memberships about kind of how do I make this best practice kind of into action on my campus. And so the goal with this draft is to really clearly and explicitly call out what are kind of the action steps to take and what are some other things that you could think about while you're doing that. And so this checklist will outline for each best practice, each of the 4 best practices, with check boxes, what those core components are, what those main things that are really needed to kind of help meet that best practice and that guidance put forth in that best practice. So again, if we come to speaking about health promoting environments, one of the things that is kind of considered a core component is really thinking about all the different environments and levels that a student athlete might be in, all the way from the individual student athlete to the relationships they have with coaches and teammates and faculty members, to what the general campus environment is like. And so there's a checkbox that will say considers multi-level environments, and that is a core component. Other things that are things to kind of think about how they might fit with resources are noted by bullet points. And so there isn't an associated checks box with them. And those are, again, just intended to be kind of reminders of things to be thinking about when you're meeting those core components or kind of putting those checks in those boxes. So the checklist will absolutely outline those core components with check boxes for membership to have clarity of understanding what those specific things are.
All right. Well, thanks for that. And I'm sure that's a relief to the membership as well. I want to call out another thing you mentioned. It was screening. So we're starting off with creating an environment and then moving to screening. So in the prior iterations of the mental health best practices, screening was something to consider. But now the mental health advisory group is saying, well, look, screening is now so well established, kind of like cardiac screening. We aren't saying this is exactly how to do cardiac screening or this is exactly how to do mental health screening, but there's so much literature and science now about screening that it's something that really should be done. So maybe Jamie and Carrie, talk to us about how we've moved from sort of, well, maybe consider it, here are a bunch of possible tools, to the fact that, look, screening is now state of the art and state of the science, and working with student athletes or really with anyone from a mental health perspective.
Well, I really appreciated that, and from my perspective, screening does a lot of different things. Especially, it links a lot of the best practices actually too, if you think about it. So, if in a circumstance somebody is asking a student athlete about mental health, and they're going through, they have a checklist or a kind of I have a screener. They're having the conversation. So having the conversation is huge. Just bam, you're right in front of the person and you're having the conversation. And then you also get to kind of be able to see what level or how the person is doing. So what I like about screening is thinking that we might be able to potentially get in front of every student athlete 4 times in their career. And that's great to even think about 4 times in front of their entire career while they're here. That's good. And then we get to understand, how are they doing? What's their stress level? Would they need a routine referral to like some mental health services, or are they currently in a state where they might need more of an emergency a referral? And then thinking about how that might relate to maybe programming we have on campus or within our unit, how we could get them to that. So it gets us in front of the student athlete. And what I also like, Carrie, you mentioned it, the flexibility of when to do it. Thinking about, we have 1,100 student athletes here. So thinking about doing 1,100 mental health screens at the very beginning of the year is very overwhelming for me and my staff. So thinking that there's a little flexibility there, that's very helpful, and it can get a lot done at the beginning.
And I'll just add on to what Jamie said, which, I mean, I think absolutely the opportunity to have the conversation is a huge part of it. But another aspect about it too, I think, is an attempt to be proactive. And so screening is one way to help identify a student athlete who may be at risk of developing or having a mental health condition. It's not intended to be the diagnostic piece or to diagnose someone. But by screening, we get the opportunity then to potentially identify student athletes who may be struggling with depressive symptoms or anxiety symptoms, or having and experiencing other symptoms that may be associated with a mental health condition. And so we have the opportunity to identify these student athletes early and refer them to the appropriate resources to help them sooner, so that it's not waiting for a student athlete to be in a crisis moment before that referral process happens. So again, I think the screening component is another way to help be proactive and identify early and take the appropriate referral steps to best help and support our student athletes.
Yeah, and again, I'll just emphasize, screening for mental health symptoms and disorders is no different than screening for potential cardiac issues or musculoskeletal issues. So it really, the physical and mental are so intertwined. Let's just finish maybe by Carrie and Jamie sharing with us, what can the membership do now to prepare for this release, the updated mental health best practices? Well, part of what the membership can do now is to stay tuned to these webinar series, or if you've missed some of them, we're going to post all of the ones that we did before. So that's a big part of it. But what else, Carrie and Jamie, can the membership do now?
Well, I'd recommend first and foremost being familiar with the mental health best practices as they currently are. As I said earlier, there are some subtle changes in the upcoming update, but really having a good understanding and foundation of the existing mental health best practices, I think puts membership in a great position to be prepared for the upcoming update. And I'll also throw out that we anticipate having an educational session at convention in January 24 to talk in a lot greater detail about the update. So certainly put that on your calendar and come hear more about the update at that point in time as well. And Jamie, I'd love to hear what your recommendations for membership are as well.
Yeah, I mean, I think from my perspective, I'm just thinking, here we are in October. The caseloads for us on the ground here are ticking up. And it's easy to just keep your head down and just focus on the student athletes in front of you. Taking a moment, take half a day, take an hour, zoom out and take a look at your services, take a look at how it's going at your university or college, and think about how you're enacting these. And then you can zoom back in and then think about these resources that are being provided here, the webinars and come see me at the conference I'm going to be presenting, I think maybe. And we'll just get more familiar with it so we can go forward.
I think that's great. And, another thing is just really talk about it within your athletics department. Speak about it with one another. Hey, what do we have right now? If you don't know, it's just ask the question. It's kind of like screening in a way. And see what, and ask the student athletes what they would like, because the mental health best practices are going to have so much flexibility in them that it would be really nice to hear the voice of the student athletes and to roll it out with them in mind. And especially talk to the coaches as well, because in the very first part of the mental health best practices, if we could call it the first building block of the best practices, creating a healthy environment, a lot of that is going to depend on the coaches. They're the single most important influence day to day on a student athlete from multiple points of view. So just start having the discussion as well while you're doing the review. Well, that really is it. I really appreciate Jamie and Carrie. First, I want to call you out for your leadership in this. It's just been exceptional from both of you. So we're going to take a little pause and then we'll have some time for questions and answer from the membership. So thanks again, everyone.